Thank you, Srini. Wonderful topics that you have chosen. Arup sir just told us how difficult it is and what are the complications that you encounter when you do a leathery cataract, and we'll be just discussing what are the different ways to avoid those particular complications, zonal stress and thing. Uh, what is the problem is, what happens is the posterior plate doesn't cut. That's the major problem that we face in a leathery cataract. So there is an incomplete track. The chop, however you do, it extends up to the central, but beyond the central it doesn't happen. And what is that we need to do? I think first we should understand what is the problem with the post leathery cataract. A normal cataract, if you see, there is a nice space and a cushion of the epithelial of the endonucleus. Here what is happening here is there is a lens fibers are totally adherent and making chopping very difficult, and most important there is no cortical cushion. So that this problem, the totally adherent fibers at the posterior plate is the problem that is created to us. So normally the chop what happens is you go and impale and do the chop. There is a splitting happening, but only up to the center, but it doesn't go beyond the center. So in such cases, the regular chopping, what we normally do is we do sequential chopping. We go rotate and keep chopping, keep chopping. At some point, the central portion gives up, and that is when we start eating the wedges part by part. See there are many other techniques. I think Vanti initially had just had given us some techniques like crater and chop. That was what the beginners they used to do, and then we came to the stop and chop. This is Cheng. He developed this drill and chop. What exactly happens is you have to impale as much as possible up to 2/3 of the nucleus, impale and then do the chop. Here exactly this is, he represents what the miners do. Either one single impale, or you can do consecutive drilling like 1, 2, 3 from the capsular rectus margin and then go and do a chop. So this way what is happening is the central portion is getting debulked, and at the same time the holdability, that is what is important. The more you impale and more deeper you go, especially in such leather, you are going close to the posterior plate, and then use mechanical forces to cut, so that eventually cuts the posterior plate. So the important thing here is exposing the tip at least 3 millimeters. We suspect that the lens thickness will be somewhere around 4 or 5. So 3 millimeters of, you pull the sleeve back and then impale, you get around 3.5. So you're going around 2/3 thickness. That's very important. That's the increases the holdability and reduces the stress on the zonules. So here from the capsule edge, what we normally suggest is go from the capsule, not at the center, go keep impaling with the bevel down, and as you go deeper and deeper, you hold just like a driller, what the driller does, and then go and do the chop. The cut occurs eventually at the posterior plate. Yes, you can see the, then you go and do the other half. You can see the complete posterior plate that is being cut. And then you can go ahead and do like a routine case. And what is important, once you take off one piece or one wedge, then you have adequate space to maneuver, and that will help you to further go ahead with this one. Stop and chop, and Arup was telling that beginners, you go and do only stop and chop, trench. And what are the common mistakes that happens here is either, so the normal thing is you should have two tips wide trench, both at the proximal part and at the distal part. And sometimes it is too wide, that will not help for you to separate the plates. Ideal is 2 tip wide at the proximal end, 2 tip wide at the distal end, as much as possible, 90% depth, and keep both the instruments as deep as possible. You will be able to separate the posterior plate. So this is what happens normally when you try to sublate. Initially it failed attempts because the depth was not adequate. And as you go, then you can finally see that you retrench and you go, and finally the posterior plates separate. So the idea is you go as deep as possible, put the instruments as deep as possible, and ensure that the trench is at least 2 tip wide. And this is divide and conquer. This is the commonest mistakes the youngsters, the beginners do. The trench is inadequate. If you see, they have done a trench, but both sides it is very inadequate, and it's very difficult. And this is where you end up in most of the problems. You try to do both the trenches, the proximal or the distal is very inadequate. So this is quite adequate. You see, two tips wide, two tips both at the. In such cases, when you place the instruments at the bottom and try to split, it splits open. Of course, you have to keep rotating, and as and when you keep rotating, the posterior plates eventually gives way. Yeah. So once one wedge comes out, and it becomes easy for you to go ahead and do. So yes, newer techniques are there. Normally there tilt and crack. Sometimes you do the trench. Only the posterior plates are left over. You just have to flip it up and then eat it up and finish it. Vertical chops, circumferential disassembly. That is what sequential chopping I told. Some rings are there. Multi-level chop by Vasavada and progressive cracking. These are the various methods, but what eventually you should do is understand what is the pathology, where exactly is the problem. That is the posterior plate, hard adherent. Go deep, increase your holdability if you're doing a direct chop, and in case you are doing a stop and chop, go as deep as possible, 90% depth, and then do the cracking. Srini, thank you.